Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you know, this is a webinar about Lyme disease, and no 2 weeks are the same because you create them with your questions. I'm interested in seeing what you have in store for me tonight. Sorry to be opening the room just a little bit late. I actually wound up having to do an operating system update and got a little more complicated than I had planned on, but we should be able to have a pretty full webinar tonight anyhow. So for those of you that are new here, the way that you can write questions to me is there's a chat box over on the right-hand side of your screen down at the bottom there, and write your question to me through there. The only thing that I ask is that you try to be brief with your questions. Long questions are hard for me to actually show to everyone, and they're hard for people to track as I start reading them. So try to be brief with your questions. If they do get too long, I just won't be able to answer them, okay? All right. Second thing is send a complete question to me by hitting the enter key, only when you're done. Don't use the enter key to create different paragraphs, okay? All right. And then during the webinar tonight, I am creating a recording. And tomorrow morning, somewhere before I start my workday here at 8:30 in the morning, an email should go out to you that has information that the recording is done. And we'll also have information about how to sign up for next week's webinar, all right? So we do have another webinar next week too, and then I'll take the week off after that one. During the webinar, when I do go through a question, I will post it so that those of you that are participating in the live version can actually read it on your screen. So you don't necessarily need to listen to me read it. However, I am going to read them out loud because in the recorded versions of the webinar, those messages don't show up, okay? All right. So with that being said, let's go ahead and get started here. I'll go ahead and post up the first question. All right, so the first question is from Megan. Hi, Megan. Let's see. Hi, Dr. Ross. I have Lyme and Bartonella that have been resistant to treatment, and I dealt with a lot of neuropathy in my feet and legs. The sensation is not only tingling and vibrating, but also an achy, twitchy, and a twinge type of pain. I have the opportunity to use a Bemer mat regularly, and I'm wondering if you think I could help, if it could help with this pain, or with recovery as a whole due to the improvement in microcirculation. Question number two, actually, let's talk about question number one first. So in terms of Bemers are a device that use electromagnetic frequencies that are supposed to increase circulation. I have not specifically recommended them to patients, although I have a number of patients that have used them on their own. In other words, they found out about them and started using them on their own. And I do have a number of patients that do report some improvements with muscle pains and even neuropathy using them, okay? So that's a number of them. Now, granted, I may not be hearing from the people that tried them and it didn't work on. So I can't give a ringing endorsement, but I can tell you that some people do get improvements with them, okay? Let's see, question number two. Do you find methylene blue or liposomal oregano to be more effective against killing Bartonella and persister form, or are they equally effective? All right, so many of you may be familiar that I recently published an article about how to treat Bartonella, including treatments for the persister forms as well as growing forms. All right, so we now understand that Bartonella has growing forms, and traditionally that's what responds to regular antibiotics, and that there now are these hibernating forms that don't grow that rapidly that we call persisters that also exist too. There's been a couple research projects looking at what do we do about these persisters, and they've both been published by the same lab out of Johns Hopkins lab operated by a physician named Ying Zhang. And Dr. Zhang has shown us that that both oregano and methylene blue are two items that can actually deal with these persisters. One of the studies was published in December of last year, and more recently there was one published in April of this year. To be honest with you, I'm not able to make a distinction at this point as to which one's working better. I'm working with both of them in my practice. Some patients I'm putting on oregano, and some patients I'm putting on methylene blue, and I'm seeing some positive changes in all of them. But at this point, I don't know which one is the better one, and I'm actually working with both of them. Okay. In terms of how you use them, the methylene blue is a prescription medicine that needs to be made up by a compounding pharmacy. And the reason it needs to be made up by a compounding pharmacy is it's actually manufactured only to be given in an intravenous form, but we can have it made into an oral form. And that's a 50 milligram pill twice a day. The other option is the oregano oil, and I try to do it as a liposomal oregano oil. And the product I like using is a product that I sell through my store by Doctor Inspired Formulations. And each capsule is a 75 milligram pill. And I like doing it as one pill twice a day. Okay. Number 3, is it possible to have a happy, healthy baby once a woman has recovered from her infections, even after so much damage to the microbiome has been done from antibiotic treatment? The answer is yes. I've got a lot of women in my practice that have had babies after Lyme treatment, Bartonella treatment, any kind of treatment, and babies turn out fine, and mothers do well as well too. All right. So hope that gives you some useful information. I want to do a quick screen share here, everyone. So I'm going to show you that article on Bartonella in case you haven't seen it yet. All right, so this is my Lyme disease information site, Treat Lyme by Marty Ross MD. And take a look at my infection treatment plans section here. And this is my recently rewritten article on Bartonella. It's called Kills Bartonella, A Brief Guide. And in here, I actually have, I updated this on June 24th, actually. I guess it's getting to be, it's a 6-week-old article now. But down here, I talk about growing Bartonella and Persister Bartonella. If you want to see what I recommend, you can take a look here in terms of the antibiotics. And then in terms of the references, the 2 articles that are really interesting is the, let's see, which one is it? This last one was the article, number 5, was the one that was published in 2019. And then the more recent one is this one right here. Number 3 is the one that was published in 2020. Okay. All right. There we go. All right. Let me go back here. Okay, very good. I had to turn my head sideways there to look around my microphone. There we go. Let me bring that a little bit closer here. All right, so Megan, thank you. And let me go ahead and take the next question here. Good luck to you. Hello, Gail. Let's see. Hi, Dr. Ross. My doctor is in Europe on vacation and wants me to try to treat for mast cell activation syndrome. In his message, he says start with the simple Zyrtec, Claritin, or Benadryl one at a time, staggered. Take them at night to offset the drowsiness. Work on this over the next few days. The directives were very unclear. If I were your patient and I was very, very ill, won't go into many symptoms here, how would you have me take these medications? I think he wants me to hit them hard and see if I can get a response. Also, I'm taking 2 milligrams of Valium 3 times a day for dizziness that the ear, nose, and throat doctor prescribed. Could that alter the impact of allergy meds on mast cell activation syndrome? Thank you. All right. So MCAS, everyone, stands for mast cell activation syndrome. Okay. So mast cells are your allergy cells. They're cells that make and release histamine when something that we are allergic to is attached to them, basically, okay? We now know, we used to think historically that the only thing that really turned them on were things we're allergic to. We now know from research that's been coming to light over the last years that actually chronic infections and Moltoxins can actually turn them on too. And that the chronic infections and actually Moltoxins make it so that they more easily release the histamines that they produce. These mast cells also, in addition to making the histamines that give you your allergic type symptoms, these mast cells also have the ability to make a bunch of inflammation cytokines. And many of you know from participating in webinars that the main symptoms you have in Lyme disease are due to your immune system overproducing these inflammation chemicals called cytokines. Well, one of the cells that can do that are these mast cells too, okay? Now, symptoms of mast cell activation are basically a person has a lot of kind of allergic type symptoms. That can be a lot of nasal stuffiness. They might also have a lot of hives, for instance. Those would be the common things that make us think about it. But also, if you've suddenly got a patient that's starting to get sensitive to all kinds of medications, that sometimes can mean mast cell. Sometimes patients with an increased confusion can sometimes mean mast cell. Sometimes a mast cell can give you a lot of brain fog and cloudiness too, right? So there's different things that make us think about mast cell activation. But because mast cell activation deals with histamines, the treatments are directed at controlling the release of those histamines or blocking those histamines, okay? So number one, and although your doctor didn't mention this, one of the strongest provocative things that causes the release of histamines is stress, all right? Stress, anxiety, fear, and stress, psychological stress can be the biggest thing that activates your mast cells. So if you have techniques that you know to do that help you de-stress, make sure you do those, okay? Second thing I like to do is if I've got somebody that knows what is setting them off, try to avoid those things. So if it's dairy or it's gluten or it is the toxic partner in your life, whatever it is, try to avoid those things that set things off, okay? All right. Number three, try to eat a diet that is low in histamines. And I'll show you where you can get that kind of information here in a minute. Number four, I like to stabilize the mast cells. I like to make it so that they don't make or release histamines. And so the two things I like to use for that is a substance called luteolin and another substance called quercetin. These are both herbs that can stabilize the mast cells to keep them from releasing their histamines. The other thing you can do, if all that's not working, you can block the histamines after they've been released. And that's to use your medicines like a Zyrtec, a Claritin, or a Benadryl, right? Now, when it comes to antihistamines, Benadryl, which is our oldest one, probably is stronger than the newer generation ones, which would be a Zyrtec and a Claritin. The Zyrtec and a Claritin tend to be less sedating than a Benadryl is, but they may not work as well. I suspect what your doctor meant was try one, see if it works. If it doesn't work, then try the next one. And if that doesn't work, then try the next one, okay? And you could go in any order. You could do Zyrtec 10 milligrams. If that doesn't seem to help you much, then try the Claritin, okay? And if that doesn't seem to help, then try a Benadryl pill, for instance, okay? All right. The other thing that can help, and in addition to doing just regular antihistamines, is some acid-reducing medicines like Tagamet and cimetidine also have some antihistamine effects as well too. So sometimes we will add those in too. Okay, all right. So let me just show you a quick article that you can read about this here. All right, so I'm gonna look under my immune system part of my online Lyme treatment guide here. And take a look at this article called Mast Cell Activation Syndrome and Lyme. And in here I talk about what might cause that to happen. And then I talk about what the symptoms are. Up here, okay, so for instance, the histamine symptoms could be flushing, itching, hives, swelling of the skin, nasal congestion, shortness of breath, throat swelling, wheezing can sometimes be part of it too, okay? All right. And then I talk about testing is not that useful. And then I talk about the steps you can take to deal with it as well too. Okay. All right. And then here's that information on the quercetin and luteolin I was telling you about. Okay. Then here's information on what is a low histamine diet right there. All right, Gail, good luck to you. Thank you for that question. Hello, Nancy. Let's see. Have you found Biocidin LSF a more potent primary treatment than cat's claw and otoba? Also, have you tried Cistus tea for Borrelia? So I haven't had that much benefit from using Cistus tea, okay? In my practice, what I have found is that the strongest herbal option to get rid of Lyme is to use the combination of cat's claw and otoba, okay? And those are two herbs, again, that come to us out of the Cowden protocol. They're the only part of the Cowden protocol that I think really works. Although the Houttania can help with Bartonella, but it by itself is not enough. And Cowden doesn't contain for Bartonella sida acuta that you combine with Houttania to actually work effectively, okay? All right. So these two herbs have had some laboratory petri dish experiments done looking at them. That is the cat's claw and the otoba. And these studies were published in the Townsend Letter about, I think, 8 or 9 years ago. Eva Shoppe actually did that research on that. And her lab showed that these two herbs used together each do a good job of killing spirochete forms of Lyme and the microscopic cyst form of the Lyme germ. But also when you put the two together, you get a whopping kill. Somehow they cooperate together to help each other. And they break up the biofilm, about 100% of the biofilm. All right. Now, Biocidin, which is an herbal compound that has a variety of herbs in it, also has some compelling studies done looking at it and its benefit of breaking up biofilm and killing Lyme. And it does look impressive too. But in my practice, I find that the cat's claw otoba work about 85 to 90% of the time. The Biocidin, I'm finding it to be a useful treatment for Lyme. As a standalone medicine, meaning to kill Lyme and also remove biofilms, I find it helpful about maybe 80% of the time. Okay. All right. So anyhow, those are my responses. For those of you that want more information about cat's claw and otoba and also about Biocidin, let me just do a quick screen share on those. Okay. So take a look. Well, that's if my computer will work here. There we go. Take a look at this section called Anti-Germs, the prescriptions and herbs. And so here you'll find the article I've written on otoba bark and cat's claw. And I even cite the research of Dr. Eva Shoppe here. And then this is my article on the Biocidin. Okay. All right. Thanks for that question, Nancy. Good luck to you. Hello, Bill. Let's see. Hi, Marty. Have you heard of any Lyme patients with COVID-19? There was some news articles stating people that had been vaccinated a lot had less clinical signs because their immune systems had been stimulated by the vaccines. I would think that Lyme patients would have an activated immune system and thus may be able to react to the virus and have a quick immune response. Your thoughts? So I am seeing some of my patients that have Lyme that have gotten COVID-19. And what I can tell you is a mixed bag. There's some people with Lyme that get COVID-19 and really get over it pretty quickly, okay? There are also some of my patients that have had Lyme that are having just a nasty time recovering from it too. And at this point, I haven't had enough people yet to know whether the person with Lyme on average has any better or worse chances than the person that doesn't have Lyme. I honestly don't know, okay? And obviously that research hasn't been done too, okay? All right. Thanks for that question, Bill. Hello, Joanne. Let's see. Son being treated for central nervous system Lyme with IV antibiotics, but has hyperacusis. What can be done to alleviate this while treatment continues? That's a tough condition. So hyperacusis, which means very sensitive hearing, everyone, is a sign of neurologic irritation. Often when I see hyperacusis or extreme light sensitivity, for instance, anything that's an extreme, I'm also wondering if, in addition to Lyme, if there could be a Bartonella co-infection. Okay, so Bartonella is another germ that can be transmitted by ticks. We recognize that there are 15 kinds of Bartonella. Our testing is only decent for about 2 to 4 of those strains, depending which lab you use. And so you have to kind of have a high suspicion if Bartonella could be there. And when I'm going to think of Bartonella, as if I've got somebody with extreme neurologic symptoms. Also, Bartonella is known to give a lot of psychiatric issues like anxiety, depression. Sometimes people with Bartonella have a lot of pain on the balls of their feet. Bartonella can sometimes give you rashes that looks like stretch or scratch marks, okay? So if you have a number of those symptoms, you might want to think about covering for Bartonella as well, too, in addition to treating Lyme. The ceftriaxone would not do anything for Bartonella. Your doctors may not have even thought to look for it, and even if they did, again, the testing is not perfect for it. You got to kind of wonder if it's there, basically, all right? I'll show you an article here in a minute where you can look at treatment options for Bartonella and also how do you diagnose it. I'll go through both of those with you here shortly, okay? But in terms of how do you deal with the effect of the hyperacusis, in my practice, I have not found any decent prescription ways of dealing with that hyperacusis. Basically, the treatment is get your germs under control, okay? All right. Now, there is sometimes some of these symptoms like that can be helped with Chinese medicine or Japanese style acupuncture. Either one of those sometimes can be helpful for a lot of these difficult neurologic symptoms that sometimes people will have. Okay. All right. Let me do a quick screen share here for you. Okay. So in terms of how do you diagnose Bartonella, and when do you consider Bartonella, take a look at my section here called How to Diagnose, and then take a look at this article called How to Diagnose Bartonella in Chronic Lyme Disease, okay? And in here, I review the symptoms. I even cover some of the testing, which again, is just not perfect, okay? All right. Then in terms of how do you treat Bartonella, take a look at my article here called Kills Bartonella Brief Guide. I showed you that just a few minutes ago, okay? All right. Thanks for that question. And good luck to your son. Hello, Luke. Hold on here just a minute, Luke. Okay, let's see. Hey, Dr. Ross, I got my Great Plains labs back with a high ochratoxin A and high levels of mycophenolic acid. And I can never say this last one, zearalenone. I have a mental block on saying that one. So you've got elevations of 3 of the mycotoxins. I will not see my Lyme literate medical doctor for another month. He has suggested Desbio detox kits, but also mentioned Dr. Shoemaker and MARCONS, which got me nervous about his mold detox suggestions. I am a fan of yours and I know your thoughts on Shoemaker. Anyhow, anything I can do about these types of molds from now until I see my LLMD next month? Thanks. All right. So what I've been doing when I have a combination, this kind of combination of mold toxins, I'd like to use 2 binders to remove them. Okay. And what I like to use to bind them up, to pull them out so that they don't keep getting back into you through your intestine circulation, is I like using activated charcoal, and I like using bentonite clay, okay? The activated charcoal you would want to do is a 550 milligram pill. I usually will start people at 1 pill 1 time a day. and I'll combine it with a bentonite clay mixture, which is called MediClay, and I'll have them take 1 pill of that too. After somebody is stable on that for after about 7 days, I would add in a second time of day where you're taking one of the bentonite clays and one of the activated charcoal later in the day too. When you use your binders, you want to make sure that you're taking them away from everything else, okay? Because remember, they're binders. They might bind up other medicines or herbs or supplements. So I usually advise that people stop all their medicines, which means herbal and prescription medicines, 30 minutes before they take the binders, and then you can resume them 2 hours later, okay? So why am I talking about binders? So for those of you that aren't familiar with all of this, there's some of us that one of the factors that can contribute to somebody's having difficulty in Lyme, or can actually mimic and act just like Lyme does, is to have something called Moltoxin illness. And specifically what we know from Dr. Shoemaker's work is that Dr. Shoemaker, who was one of the first persons to describe this condition called Moltoxin illness, he was able to show that 25% of people have a genetic predisposition where their immune systems are not programmed correctly to handle moltoxins. What's supposed to happen in 75% of us, and this is what does happen, is we breathe in a moltoxin from the environment around us. It gets absorbed into our bloodstream, and our immune systems will tag them, and then other parts of the immune system will come in and break those moltoxins down. If you're one of the 25% that has this genetic programming error, the immune system will not correctly tag those toxins. Those toxins then go to the liver, and the liver is supposed to transform them from a fat toxin into a water-soluble toxin, but it can't do it. So they come out of the liver and they get moved into the intestines, still as a fat-based toxin. And then in the intestines, because they're fat-based, they get reabsorbed right back into the bloodstream. If they were transformed into a water-based toxin by the liver, they would mix in our poop and we'd poop them out. So what we want to do is we want to grab hold of them in the intestines so they don't get reabsorbed again. Okay. All right. Now, the other thing, as I mentioned earlier, this can look just like Lyme, because remember, Lyme disease, the reason you feel badly is your white blood cells, in trying to deal with Lyme, manufacture a group of chemicals called cytokines. And if you have too many toxins in your immune system is going to manufacture a bunch of chemicals called cytokines. If you have too many yeast in your intestines, your immune system is going to manufacture a bunch of chemicals called cytokines. Okay, here a common thread here. So too many yeast in your intestines, Lyme disease, and Moltoxin illness at times have some very similar symptoms. And that is those excess cytokines that your immune system makes can make it so you can't think, can make you hurt all over, can interfere with how your hormonal systems work, so you can have low thyroid, low adrenals, can disturb your sleep centers. You get the idea. Make you hurt all over. Basically, when we say somebody has Lyme disease symptoms, they have too many cytokine symptoms. And so therefore, anything else that triggers too many cytokines will also mimic what Lyme looks like as well too, and can make your underlying Lyme symptoms look a lot worse too, okay? All right. So the reason I'm not a big fan of Dr. Shoemaker is that although I think he is great for what he discovered, the science has moved beyond him. And he still is like a dinosaur that hasn't advanced how he treats this, okay, and how he diagnoses it. So Shoemaker, when he came up with his theories, would make a diagnosis in somebody based on whether they had the genetic profile for the problem, and also whether their blood testing showed if they had some inflammation patterns that you might expect with blood inflammation testing, okay? However, a number of years ago, there's a number of labs that came up with another way of looking at this, and that is to prove that you actually do have too many toxins in you, okay? Because Shoemaker's testing showing inflammation and showing a genetic profile doesn't prove you have the problem. In fact, a lot of Dr. Shoemaker's labs that could be used that indicate inflammation, those same inflammatory chemicals like an MMP9 or a VEGF, some of the other ones, a C4A, et cetera, all those other inflammatory chemicals that he looks at also can be triggered by Lyme. All right. So anyhow, they don't indicate that you truly have moltoxins in you. So what's revolutionized the treatment of moltoxin illness is actually being able to measure whether they're in you. And so there's a number of companies out there now making urine testing where you can see if you're peeing out a lot of mold toxins. One of those is Great Plains, like you had done. There's another lab in Texas called Real Time. And they both look, through different techniques, they can tell you whether you're peeing out a lot of excess toxins, okay? One last thing that I don't appreciate and I don't work with on a Dr. Shoemaker's protocol anymore is this idea of MARCONS. So MARCONS, so what Dr. Shoemaker was able to show is that, yes, if you have mold toxins, it can inflame you. And if you would go through steps to remove those mold toxins with binders and somebody still remains sick, Dr. Shoemaker proposed that this basically then becomes a condition where you have ongoing chronic inflammation. And after you remove mold toxins, the second step in his protocol to decrease that inflammation was to look and see if you might have an infection in your nose passages called methicillin-resistant coagulase-negative staph, which is also known as MARCONS, okay? And so under his theory, he proposed that you treat it with a nasal antibiotic spray and also a drug called rifampin. The trouble is, I never saw anyone get better by doing that, even when I got the germs out. And in addition, it's next to dang near impossible to keep them out. They keep coming back. So I don't believe MARCONS makes any difference when we treat it. And I now am more of a believer that probably this bacteria is something that's a common benign bacteria that we just happen to find living in the nose. So I don't believe in treating for MARCONS either, okay? But doctors that trained under the Shoemaker theory will still try to treat MARCONS, even though it's about dang near impossible to get rid of it and keep it gone. You might be able to get rid of it at first, but it's just going to keep coming back, basically, okay? So I don't believe in treating for MARCONS either, all right? All right, so let me just, anyhow, I think I've said enough there. All right. Good luck to you, Luke. Oh, I know what I want to show you. Okay, so in terms of these binders that I was just talking with you about, you could take a look. So the ones that I work with, and this is my supplement store. Anyone can purchase these supplements. You don't necessarily have to be a patient of mine, but these are the ones I work with my patients because I found them helpful. For the activated charcoal, I'm using a product by Integrative Therapeutics. It's this one called activated charcoal. Okay. The other product that I'm using for the bentonite clay is a product called MediClay. Let me try it that way. And it's this product here, okay? So MediClay, and it's bentonite clay. Oh, I was spelling it wrong. It's BENTONITE, okay? All right. All right. Hello, Kelly. Let's see. What is your go-to for neurologic Lyme flare-ups? And thanks for all you do. So there's different ways I could answer that. If you're talking about what is my antibiotic combination I might use for neurologic Lyme, I like working with, you could work. So I tend not to do IV antibiotics in my practice, just so you know. I think there's too many risks involved with them because you have to put an IV line in, and that IV line can clot and sometimes have pieces that break off of the clot and go to your lungs. And sometimes when we leave those IV lines in, called PICC lines, they also can get infected. And about 15 to 20% of the time, they become a problem, okay? I have found that working with oral antibiotics can work just as well, but you want to work with things that have a good chance of getting into the brain. My go-to regimen for this would probably be to use either minocycline which is a 100 milligram pill twice a day, coupled with a drug called rifampin, 300 milligrams, 2 pills one time a day, or minocycline in some people sometimes creates dizziness. If that happens, I would probably use doxycycline, which has pretty good brain penetration too. That's 100 milligrams twice a day. Okay. So if you're just asking for what the antibiotics are I would use, that's probably what I would wind up doing. Okay. All right. The reason I choose minocycline over doxycycline is it is more fat soluble, and things that are more fat soluble have a better chance of crossing through what's known as the blood-brain barrier. Okay. The blood-brain barrier is literally a layer of fat that keeps things from getting from the blood into the brain. The brain's trying to protect itself from toxins. And even though the doxycycline is not as fat soluble, it still has pretty good brain penetration. Okay. All right. Thanks for that question, Kelly. Good luck to you. Hello, Geraldine. Let's see. What do you think of the possibilities of azlocillin? All right. So let me talk about what azlocillin is first. So many of you are familiar with disulfiram. Disulfiram is a drug that's used to treat alcoholism that many of us are now using to treat persisting Lyme symptoms. Okay. The lab that created or that discovered that disulfiram has some ability to treat persistent Lyme is a lab out of Stanford University. And the lead physician there is Dr. Rohatis. Rohatis has been investigating a number of agents to see if there's other chemicals that we can use to treat persistent Lyme. Again, everyone, what persistent Lyme is we now recognize that Lyme has growing forms and Lyme has these persisters. Persisters you can kind of think of as hibernating germs that aren't growing rapidly and therefore do not respond to the typical antibiotics. Rohatis has been able to show in his lab that azlocillin is able to treat both persisting forms of Lyme and even growing forms of Lyme. It is a penicillin, and it's already been approved as a drug by the Food and Drug Administration, so it doesn't have to go through all kinds of safety studies, et cetera. It was not approved to treat Lyme, but it still has been an approved drug. And we can use medicines off-label to treat conditions that a drug wasn't approved for, as long as there's some scientific foundation for why it might work for the condition that we treat. Okay. So the thing is, at this time, though, there is not a manufacturer of azlocillin in this country. And from what I understand, Dr. Rohatis has put together a group of people, and they're trying to get a manufacturer operation going. What we do not know from Dr. Rohatis' study is this going to make a difference in a living human? All right. So you have to keep in mind, even though I like working with laboratory experiments like Petri dish experiments and test tube experiments to give me insights about what might work with the person, the only way to really know if what happens in a lab is going to work in a living human is to try it in the living human. All right. That's human research. And frankly, we don't know. And because this drug isn't available to try and to even give to people, we have no human experience yet to show whether it's going to work. So I don't know. It looks promising in a lab, but whether it's going to make a difference in a human, I have no idea. Sometimes things that look great in a laboratory experiment do not pan out at all when we actually start giving them to people. Okay. All right. Thanks for that question, Geraldine. Good luck to you. Hello, Naomi. Let's see here. Let's see. Thanks, Dr. Ross, for sharing with us. You're welcome. Let's see. I have a few, hopefully, quick questions. One, is your CRP level the only indicator for inflammation in the body, or is there another test that can be done? All right. CRP, everyone, stands for C-reactive protein. It often is elevated when people have rheumatologic conditions that give inflammation, like rheumatoid arthritis, lupus arthritis. It also can be elevated if you have acute infections in you too. But in terms of it being a good indicator of the kind of inflammation we see in Lyme disease, it is horrible. It usually has no indication as to what's happening with Lyme disease. There are other indicators you can look at about whether you might have Lyme inflammation. One, for instance, is to look at a cytokine called TGF-beta1. You can actually even measure other cytokines like interleukin-6, interleukin-8, but even the blood testing on those is not always reliable. Okay, so the answer is there's not a reliable test. Okay. Let's see, is a 1.8 milligram per liter level considered normal and therefore no need for supplements? So it is normal, but again, CRP is not the useful indicator as to whether you have inflammation and Lyme disease. And in fact, we don't have solidly good testing that tells us about inflammation and Lyme. We have to go more by symptoms, okay? Number 2, how long do you recommend taking L-theanine supplements before seeing any positive effect on easing nerve pain? So L-theanine, everyone, is an amino acid-like chemical that's found in green tea, okay? And in the brain, it is converted into a chemical called GABA. And our brain is full of receptors known as GABA benzodiazepine receptors. Benzodiazepines, everyone, as you know, is things like Valium, for instance, and Xanax are benzodiazepines. And so that they bind to this GABA benzodiazepine receptor. GABA also binds to that receptor. And also other things that bind to that receptor would be like anti-seizure medicines like gabapentin, Lyrica. All right, so anything that binds to that receptor has a potential of helping with nerve pain. All right, usually if the L-theanine is going to work, I will try to dose it up to a total of 1,200 milligrams in a day. And you could do that by taking 4 100 milligram pills 3 times a day. You can dose it all the way up to that level. Usually want to start it maybe at 1 pill 3 times a day. If that's not enough, then you go to 2 pills 3 times a day. If that's not enough, 3 pills 3 times a day, and eventually up to 4 pills 3 times a day. But once you're at a level that's going to work, you should know if you're going to be having a response usually within about 2 days or so, maybe 3 days, but it should be pretty rapid, okay? Let's see, what dose of B12 supplements would you recommend taking daily if your B12 level is 312 picograms per milliliter? And can you take too much? So I'm not aware of B12 toxicity. If I had a B12 at this level, I might look at doing 1,000 micrograms a day, okay? Let's see. And what would you recommend to do to reduce B12 level? So there isn't anything I have found that reduces B12 other than stop supplementing it, because if you get too high of a level of B6, it can actually be toxic to your nerves, okay? All right. So read your labels. Make sure that anything you're taking that has supplements and it does not have B6 in it if you have high levels of vitamin B6 and with a blood draw study, okay? All right. Good luck to you, Naomi. Thank you for that question. Hello, Danielle. Let's see. Hi, Dr. Ross. I'm just looking for a little bit of advice. I've had Lyme and co-infections for 5 years and was undiagnosed 2 years before treatment and did about 18 months of antibiotics, amoxicillin, azithromycin, cefuroxime, mostly the first 2. Okay, so you did mostly amoxicillin and azithromycin. I finished antibiotics in October 2019, but I am still having a lot of issues with fatigue. I'm testing for mycoplasma and babesia with my kinesiologist, and I'm treating using 1 wormwood capsule per day and Beyond Balance MC-BAB 2 drops. I also take a Cellcore Kidney Liver Detox, TUDCA, and Beyond Balance Tox Ease bind, but feel like I've plateaued and can't break through this final level of fatigue. Around every 2 to 4 weeks, I just get sick and get recurrent ear, chest, and throat infections. During this time, any advice would be amazing. Thank you for all you do. All right. So, to give you the best advice, because this gets to be complicated, it would be great if you and I could have a visit. And there is the possibility to do that. I'll show you how to do that later. But I do run an online consult service where I get to ask you tons of questions. All right, so the two things that pop out here is your Lyme germ treatment really done? And the other is, do you have Bartonella? Do you have Babesia? Do you have some kind of a co-infection that was missed? Okay. I don't always trust kinesiology because not all testers are good. All right. I like to make my decisions about whether you might still have Lyme living in you, or you have Babesia living in you, or you have Bartonella in you based on what the symptoms tell me. All right. So for Lyme, we don't have a good test to see if you're done with Lyme. We just got to look and see, do the symptoms still indicate it? All right. The other thing, in terms of Babesia, symptoms to think about that suggest Babesia can be fatigue, but also the other symptoms of Babesia would be having air hunger, which is a feeling you can't get enough air from time to time. Having a lot of night sweats can sometimes indicate Babesia. Having headaches in the front of the head can indicate Babesia. Sometimes having a bunch of little red blood blisters under your skin can indicate Babesia, okay? Something that indicates Bartonella can be having a lot of neurologic type symptoms, and psychiatric symptoms can indicate Bartonella. Bartonella also can be indicated by having pain on the soles of the feet. Those are things that would make you think of Bartonella as well too. Okay, all right. Other things to think about if you're not getting better is, could you have mold toxicity? If you have too many mold toxins in you, as I indicated earlier, they're going to trigger excess cytokines, and that can lead to ongoing fatigue. All right. And then finally, the other thing to consider is, from having had infections in you, it's possible you could have had some injury to your power plants in your cells, which are called mitochondria. So when you have chronic infection in you, what can happen is there's an overproduction of oxidizing agents by the immune system trying to get rid of those germs. And those oxidizing agents, although they might kill germs, also damage fat membranes in our body. Okay. Every one of our cells has an energy factory system called mitochondria. There's around 300 to 400 of them. The mitochondria membranes are made up of a double layer of fat that can get injured by all these oxidizing agents, okay? What is supposed to happen inside healthy mitochondria is sugar and fat are burned through a bunch of chemical reactions to create a type of cell fuel called ATP. If the covering on the mitochondria is damaged, there's a couple problems that happen. Number one, you don't get adequate intake of fat to the inside of the mitochondria to be converted into cell fuel, okay? So the energy factories are starved, basically. Number two, you need a healthy membrane covering on the mitochondria because it donates electrons into the chemical reactions that create energy. And you need electrons for some of those chemical reactions. So if it's injured, you don't get adequate electron donation. So the other thing to consider, besides thinking about could you have Moltoxin illness, is you might also want to consider doing some treatment for a mitochondria dysfunction by repairing that lipid membrane. My favorite item to use these days for that is a product called ATP 360 by Research Nutritionals. It contains all of the phospholipids in it that are used to repair mitochondria. There's some good studies showing benefit that Research Nutritionals has done for that. You would do 3 pills 1 time a day. I also, as a minimum program to repair mitochondria, I'd like to have people take glutathione. Glutathione is a very powerful antioxidant that actually repairs injury from the inside of the cell, the inside of mitochondria. And for that to raise glutathione levels, I like to use a product by Research Nutritionals called Liposomal Glutathione. And I like to have people take 5 milliliters, which is a teaspoonful, 1 time a day of that, okay? So, and then to see if that's gonna work, you wanna try it for a minimum of about 2 months. If it is helping your energy, then you would wanna increase it to taking it, you want to keep taking it, not increase it. You want to keep taking it for a minimum of 4 more months, okay? Now, the only caveat I have for you is if you start using prescription atovaquone or malarone or mepron to treat your Babesia, you don't want to use ATP fuel because ATP fuel has a micronutrient in it. In addition to those phospholipids, it has some coenzyme Q10. And CoQ10 interferes with the Babesia treatment that it has atovaquone in it, which again, you can find in Mepron, Malarone, and in generic Mepron, which is called atovaquone, okay? All right. But to give you the best advice, you may want to set up a consult visit with me. So let me do a quick screen share here for you. All right. So bear with me. I actually just forgot what I was supposed to be looking for here. Hold on here a minute. So what was your question? Oh, yeah, that's right. All right. So in terms of where to go to find me, so if you look at my Lyme disease information site, you see this clinic link up here. It'll pull you to my clinic page. Take a look at the two types of appointments that I offer here. And one of those is a full medical service where I can prescribe. The other one is a limited consult service, okay? For full description of each of those visits, read these entire sections down here where I talk about pricing, what I can and cannot do in each of them, the limitations, etc. And if you want to do that, then click this Book Now button up here, okay? All right. And then in terms of a little bit more information about mitochondria repair, take a look at my article here called Energy and Fatigue. Take a look at this article called How to Fix Mitochondria and Get Energy in Lyme Disease, okay? All right, let me go back. All right. Thanks for that question, Danielle. Good luck to you. All right. Hello, Erica. Let's see. What is your opinion on disulfiram? All right. So, as I mentioned earlier tonight, disulfiram is a drug that is used to treat alcoholism and now has become a medicine we use to treat persisting forms of Lyme. In addition to helping with persisting Lyme, it does appear to have some ability to help with Babesia, but I would never use it as a single agent to treat Babesia. And based on my experience, but also based on some research that came out of Johns Hopkins in April, I do not think it has any benefit at all for Bartonella, okay? So I am primarily adding it in as a treatment for Persister Lime. My opinion is it can work to get put Lyme into remission in about 30% of people. And that's based on my own experience working with the medicine and also based upon the experience of Dr. Ken Liegner, who is one of the first doctors that started using it. Okay, so it can help 30% of people get into remission. There's about 20 to 30% of people that have a really hard time taking it and have to stop due to side effects or because they just can't tolerate it for other reasons, okay? There's a group of people that do get better on it, but don't get all the way well then, all right? Now, in terms of using it, it's a medicine that you have to start low and slow because it probably does a good job breaking up biofilms. In addition, it kills Lyme. And because of that, you can get huge Herxheimer reactions. So you have to start low and slow. It can take maybe about 2 months, 3 months, sometimes longer to build it up to a full dose. And then once you're at your full dose, we have a person stay there for about 3 to 4 months. That's when we find the most success, okay? So this becomes an 8 to 9 month treatment in a lot of people if you're going to do it. It is an agent that can be used alone, but also on some of my patients, if I think that they're still having a problem with growing forms of Lyme, I will combine it with other antibiotics that treat the growth form of Lyme. About 10 to 15% of people in my experience develop mental health problems on it, and sometimes we have to stop it because of that. Those mental health problems can be depression, anxiety, hallucinations, okay? And about 10 to 15% of people seem to develop neuropathy on it. That neuropathy sometimes can be helped by having a person on glutathione, and also having them on zinc can make a difference for that, okay? when you take the medicine, you have to avoid anything that has alcohol or can be turned into alcohol. So that means no alcohol in your food or to drink. That means no alcohol in your hand sanitizers. It means no alcohol in your mouthwashes, and it means no alcohol in anything that's going to be part of your skincare routine. Okay. It also means no vinegar, and that means looking for vinegar in your condiments. So, like mustard has vinegar in it. And it also means avoiding things that are fermented, like kombucha and a sauerkraut, for instance. Okay. All right. So there's a lot of life disruption that you have to use when you use this medication as well, too. All right. So my thoughts are, I think it can be useful. I think it's been a game changer for a lot of people with their Lyme. I think it can put about 30% of people into remission, but that means, but there's about 20% of people or so that can't handle the effects of it, and there's another group that gets moderate improvements out of it. Okay, all right. So those are my thoughts. All right. Good luck to you, Erica. Thank you for that question. Let's see. Hello, Michelle. Let's see. If on IGeneX test bands on Lyme Immunoblot IgM 31 and 41 are indeterminate, and IG band 31 is very positive and 41 is indeterminate, and I have moderate high score on the Horowitz questionnaire, do you feel I should be treated for Lyme disease or fibromyalgia? And when is it Lyme and not fibromyalgia? Okay, so first of all, so your testing is, so what the Immunoblot does, everyone, is it looks to see if your immune system is making antibodies that attach to various proteins found in the covering of the Lyme germ. And the Immunoblot, which is a test done through IGeneX, looks to see if you're making antibodies against 8 kinds of Lyme germs. Okay, it's pretty good. All right. The regular Western blot that IGeneX does, by comparison to the Immunoblot, looks to see if you have antibodies against 2 kinds of Lyme germs. And the standard Western blot that is done by LabCorp and Quest, that looks to see if you have antibodies against 1 strain of Lyme, okay, so which means it's not as useful as a test as the Immunoblot. All right, now the Immunoblot has the ability to find Lyme if you have it about 95% of the time. It's a pretty good test, okay? Now, but it's still possible. There's 5% of people that can have Lyme that have enough immune suppression going on that the immune system doesn't develop a strong reaction. And that could be what's happening with you here. So if you have a lot of symptoms and you have a test like this, sometimes what I will do is I will use antibiotics for about 3 to 6 months to see if we get anywhere with treatment. So I use my antibiotics as a diagnostic tool to see if we can get some improvements, okay? So that's probably what I would wind up doing here. In terms of fibromyalgia and Lyme, so Lyme gives muscle pain. Fibromyalgia is a diagnosis we give for people that have a lot of muscle pain and fatigue for which we cannot find a diagnosis, all right? So if you have a lot of muscle pain and fatigue, we call that fibromyalgia. If you have an identifiable cause of that muscle pain and fatigue, like Lyme is causing it, then you wouldn't call it fibromyalgia. You would just call it myalgia, which means you're hurt, and probably it's Lyme that's triggering it, okay? All right. Thanks for the question, Michelle. Hello, Tracy. Let's see. Hi, Dr. Ross. 2 questions. Can I take both liposomal Biocidin for Lyme and a capsule Biocidin for gut dysbiosis? And would I need to alter the dosage if I do take both? Any thoughts on serrapeptase as a biofilm buster? Okay. So liposomal Biocidin is microscopically wrapped in fat to increase its absorption. And because it does have its absorption increase, that's going to leave less behind to treat gut problems, okay? So when I'm treating somebody that we're using the Biocidin either to treat SIBO in the gut or parasites in the gut or yeast in the gut, I'm going to tend to use either the drops, the liquid drops that are not the liposomal drops, or the pills. If I'm using Biocidin to treat Lyme, I'm going to tend to use the liposomal variety so that it gets absorbed into the bloodstream. Can you mix both together? Yes. And I do sometimes. If I'm going to mix them both together, you need to keep something in mind, and that is the stuff that is the pills and the drops still have some absorption into the bloodstream, okay? So what you might want to do, and I'll do this sometimes, if I'm going to use a Biocidin LSF, the liposomal form, if I do that on its own to treat Lyme, I'm often going to work up to 2 pumps 3 times a day. For the caps, for the liquid drops, for instance, I might, to treat intestinal problems, I might work up to 10 drops 2 times a day. But what I would do with them, if I'm going to be using both together, that is the liposomal Biocidin with either the Biocidin drops or the Biocidin capsules, I might have both the doses. So for instance, instead of working the Biocidin LSF up to 2 pumps 3 times a day, I might do it as 1 pump 3 times a day. And then I would combine it with the Biocidin drops that I normally would work up to 10 drops 3 times a day. I might just go up to 5 drops 3 times a day on that. Okay? All right. All right. Good luck. Oh, you have a second question here. Any thoughts on serapeptase as a biofilm buster? I think there's better biofilm busters. It can work, but I think that you could, lumbar kinase, which is a group of enzymes made by earthworms, I think is stronger. I think that the combination of Biocidin, I think, is a stronger biofilm buster. I think a BioDisrupt, a product by Research Nutritionals, which has a number of enzymes in it, is a stronger biofilm buster. I think using the combination of otoba and cat's claw that tell us that Petri shows breaks up 100% of biofilm is a better biofilm buster too. So I think you have better options. Okay. All right. And so let me just show you an article you can look at for those options and you can see what I'm talking about. All right, so for biofilm busters, take a look at my article, my section on biofilms, and take a look at this master article where I review a number of options that you have to treat the biofilms, okay? And any one of them that I mentioned in here is probably going to be more effective than the serapeptase. Thanks for that question, Tracy. Good luck to you. Hello, Geraldine. Let's see. Are there problems with toleration of vaccine for shingles for people who have Lyme or are in remission? So many of you may be aware that some people with Lyme, when they get vaccinated, may have some worsening. That predominantly seems to be a problem with the flu vaccine, and it is not a universal problem that happens with all vaccines, okay? Nor does it universally happen in everyone, too. So I have not seen it happen with the shingles vaccine, which is what you're talking about here. I have seen people have worsening with flu vaccines by comparison, okay? All right. Thanks for that question. Hello, Kelly. Let's see. If you're treating both Lyme and mold, what would you do? What would you go after first, or would you treat at the same time? Thanks. All right. So a lot of that, what I'm going to treat first is going to depend on the history that I get from the patient. And so, for instance, if it is, if a person comes in testing for both Lyme and they've got mold testing that's positive, and they tell me that they did great, they were living well until they moved into a place that exposed them to mold, I'm probably going to treat the mold toxins first. I have found at times that if we just get mold toxins out in that kind of a situation, that often we don't even need to give any antibiotics for the Lyme. And the reason is Lyme may not be their problem. It's possible to test positive for Lyme and your immune system is done. Let's work keeping it under control, and so you don't need to take any antibiotics, for instance. Okay. On the other hand, if I've got somebody that does not remember a solid mold exposure and they really did get sick related to an obvious tick bite, I'm going to go after Lyme first. All right. If I've got somebody, though, it's not clear which one came first, I'm often going to start treating for the Lyme infection first. And as we get into treatment and they stabilize on that, then I'm going to wind up adding binders in to deal with the mold toxins too. Okay. Now, back to the first point when I said sometimes you don't even have to treat the Lyme. I've had a number of patients in my practice where I took a detailed history from them that I found out that they got exposed to mold and that's when they got sick, that I haven't had to do anything for their Lyme germs. I've just gotten mold toxins out. That's all we needed to do. And they got 100% well. One of my favorite patients regarding that is a patient that came to see me after seeing another provider here in town who had told him that he is going to have brain injury if he didn't get his Lyme treated, and she advised him that he needed to fly out to Washington, D.C. to see Dr. Jemsek and get on IV antibiotics. And if he didn't, he was at great risk and peril. And so he came in to see me for a second opinion, and I got his story, and I agreed. He had evidence of Lyme. Yeah, there was solid evidence of that, but it has a clear story that he was in great health, coaching soccer. I think he worked within a financial advising role and was doing great in his life. And then he moved into a house that had black mold on the wall and he got sick. All right. And I said, I think you may have Moltoxin illness. And so we got Moltoxin testing done, the urine mycotoxin testing, came back with huge elevations. We spent, I think, about 4 to 6 months just using binders with him, and he's back living his life fully. He doesn't have any illnesses anymore, and we've never had to do anything about the Lyme germ with him at all. Okay, all right. So a lot of it is you got to make sure you're doing a good job. Your doctors need to do a good job making sure they take a history to try to determine what came first, what's the most likely cause of the problem. Okay, all right. Thanks for that question, Kelly. Good luck to you. Hello, Naomi. Let's see. Thanks, Dr. Ross, for sharing with us. I have a few. Oh, we already answered that. I think you tried posting that twice. All right. This next one's from Roman. Let's see. Hello, appreciate your wonderful advice always. You're welcome. Let's see. I was diagnosed with Lyme a couple months ago, and yesterday finished my 6 weeks of Doxy and the Green Dragon Botanicals Core Protocol capsules. I never developed any symptoms, so I was wondering if I do anything or take anything going forward, or just wait and hope no symptoms develop. Thanks. Let me see. Okay. So I guess I'm not fully clear here. I'm going to make some assumptions. So if you were treated, the way your question reads to me is that you haven't had any symptoms of Lyme disease, and which makes me wonder if you were treated because you had a tick bite. If you got a tick bite and you were treated with doxycycline for 6 weeks and did not develop any symptoms, I think there's a good chance you are done treating and you will not have any problem with the germ coming back or bothering you in the future. Okay. All right. And I think that's what you're saying here. Okay. All right. Good luck to you, Roman. Thank you for that question. Hello, Michelle. Let's see. Any suggestions for a good naturopath in Canada? I live in Ontario, who has strong assessment and treatment skills sorting out Lyme versus fibromyalgia, who can even use your protocols. I'm more familiar with the naturopaths that are out in British Columbia and Alberta, mainly because I'm in Seattle, Washington. I'm kind of near both of them, okay? I don't know who is working out in Ontario, and I'm afraid I can't give you some good ideas there. The naturopath that I like working with in British Columbia is a woman that practices on Vancouver Island in Victoria named Maria Borman, who does a good job. But I'm not sure who is out where you are. She may know, though, being Canadian, being a naturopath. I mean, you might even consider looking her up and then contacting her office to see who they might recommend for you out in Ontario. Okay? All right. Good luck to you, Michelle. Thank you for that question. Hello, Kelly. Let's see. Have you heard of any hoppers DNRS used for Lyme? If so, what do you think? Okay. So any hopper teaches a program of kind of neurologic retraining so that your nervous system is not overreactive, and it's a way of calming the nervous system to get rid of the remaining Lyme symptoms. The idea is that once you have Lyme, your nervous system can become overreactive, and that there's a variety of things you can do to retrain it so it's not. For some people that have been treated with antibiotics and are not getting better, some of their symptoms could represent a neurologic holding or reactivity to the germs. And her program, I think, is a way of treating it. I think for some people, it actually does make good improvements. So I think it's valid. It doesn't work for everyone, but I think it's something to think of, especially if you've been treating for Lyme, you're just not getting nowhere. I think there's some reasons to look at the retraining program that she offers. Okay. All right. Thank you for that question, Kelly. Okay. Some people that posted their questions twice. So if you see me reading for a little bit and then I'm getting rid of things that have already been posted here. All right. Let's see here. Hello, Joyce. Let's see. Hi, Dr. Ross. Have you ever heard of anyone getting hot flashes from taking a combination of the following herbs? Sida acuta, hootenea, cat's claw, and banderol. I'm up to 35 drops of Sida, 30 drops of hootenea, 10 of cat's claw, and 6 drops of banderol. Within 1-2 hours of taking these, I break out in a profuse sweat. I live in the Phoenix area, so I'm not sure if the high temps are driving this. Thank you. The only thing I've seen sweats like that could sometimes mean hormonal changes. And the only one of these drops that has a potential hormonal effect would be the cat's claw. Sometimes it has an estrogenic effect. You might want to pull that one out and see, are you still having the kind of symptoms that you're describing? So pull it out, stop using it as a way of experimenting to see, could that be the culprit? Okay. If it is, what you could do is substitute in for the cat's claw a teasel root. That's Teasel. And you would wind up wanting to take that and also work it up to 30 drops twice a day. Okay? All right. Thanks for the question, Joyce. And good luck to you. All right. Hello, Hayne. Hold on here just a minute. It's getting long on the webinar here, and I'm getting thirsty. So hopefully I can hold up here. Let's see. Hi, Dr. Ross. Thank you for all your advice. Your webcasts are so helpful. You're welcome. Let's see. Do you have any recommendations for someone who is extremely sensitive to drugs and herbal medication? I was diagnosed with Lyme, Bartonella, rickettsiosis in December 2018. I started treatment in February of 2019 and tried many regimens for Lyme. Doxycycline was not tolerated. Beyond Balance, BP1 and BAR1 not tolerated. Cemento and Banderol was tolerated for about a month, having reached the 25-drop dose, but then I developed very bad GI inflammation, heartburn, intestinal pain, so bad I had to stop the products. I recovered after a month and restarted at 1 drop per day, and again got very sick to my stomach. I've tried several detox products, including Liposomal Glutathione. They are not tolerated, and I developed very bad intestinal inflammation and pain. Feel okay some days, but have many relapses and flu symptoms of chills, GI upset, weakness, and body ache. Thank you for any suggestions. So Hayne, when somebody's really sensitive, it takes a bit for me to tease out exactly what's going on. Okay, so one thing you might want to consider, and I'd be glad to look at this with you, is set up a consult visit. I showed you earlier how to do that, but take a look at that. It might be that I sit down with you online and I can ask you a lot of questions and kind of tease this out a little bit. But there are two things you may want to look into. One, especially with some of the GI reactivity you've gotten, is it's possible you've developed too many yeast in your intestines. If you get too many yeast, that triggers a lot of allergic type reactivity. And so take a look at the articles I've written about how to determine that. The other articles you might want to take a look at would be information about mast cell activation syndrome. I talked about that earlier tonight. That also can give you a lot of reactivity as well, too. So let me do a quick screen share. I'll show you those articles again so you can take a look at those and consider whether they might apply to you, okay? Let's see here. All right, let me go up here. I'm just going to do a quick screen share again. All right, so take a look at the article again. Well, actually, for the yeast, how to diagnose yeast, take a look at my yeast section here and take a look at this article called A Silent Problem, Is It Yeast? And I walk through how you can diagnose yeast to see if it's a problem, okay? If you think you have yeast, then take a look at this article over here called Kills Yeast, A Brief Guide. This is where I reviewed treatment steps to get rid of too many yeast in the intestines, all right? And then for my mast cell activation syndrome article, again, I showed this earlier, but take a look in my immune system chapter and take a look at this article here to see if you think that applies to you, okay? All right. Thank you for that question. Hello, Lynn. Let's see. My daughter has a history of chronic Lyme and BART from childhood. She is now 24. She has always had stomach issues and headaches on and off since then, so never fully resolved. 18 months ago, she was treated with IV antibiotics and then oral for sepsis, and in the last 6 months, her stomach complaints have now taken a new turn for the worse. She complains of constant burping whenever she eats and especially drinks anything. The worst being anything sparkly or bubbly. It all seems a little better when she avoids dairy and gluten. Does this sound like possible SIBO, or what do you think? And is the root cause potentially antibiotics from 18 months ago and or Lyme Bartonella that is still hanging around? Any suggestions for gut repair protocol? Greatly appreciated. She just relocated and does not have a new doctor yet. Many thanks. All right. So there's two things I would consider in this. One is it yeast? Okay. And I think that because the antibiotics could have knocked down the good bacteria, and then you get a lot of gassing, bloating, and GI symptoms from that. All right. So take a look at that article about how to diagnose yeast that I was mentioning earlier. The other possibility is SIBO, which stands for small intestine bacterial overgrowth. But keep in mind, yeast can mimic that. All right. So generally, even before I start testing people to see if they have SIBO, I'm going to spend a good month or two trying to clean yeast out of their gut. And only if, excuse me, yeast symptoms remain, then I might start doing testing to see if you have SIBO. The test to see if you have small intestine bacteria overgrowth is to do a breath test that will find if you have SIBO about 70 to 80% of the time. And basically you drink some sugar water and then you breathe into these tubes and we collect your breath and we look to see if you're making, if your bacteria are fermenting and creating extra hydrogen and or methane, okay? All right. So let me just show you a quick screen share on that one so you can see my article that I wrote about SIBO for you. All right. So if you're ever trying to see what's the latest thing I wrote, go here on my home page, scroll down here to the bottom, and I have this section called Latest Updates, okay? And the two latest updates are an article that I did in early August about SOT treatment, and another one on SIBO. All right, so you can click on that. The other thing to see a more expansive list of the updates that I have is just come here, click on the Lyme guide, look over here at this tab called the latest, and I keep about 10 of the most current articles that I've written here. And there again is my SIBO one. Okay. All right. I'm hoping right now I'm working on my current new article that I'm working on is a re-update on my article about what to do for brain fog. And I should have something out probably towards the end of the weekend or early next week. You'll see something new come out on that one. Okay. All right. Good luck to you, Lynn, and thank you for that question. Hello, John. Let's see. Thank you, Dr. Marty. Would be interested on your views on using B12 and folic acid in Lyme symptom treatment. You know, the B12 sometimes can be useful for people that have a lot of neurologic symptoms, but in general, that's about the only thing I would think it would be helpful for. Folic acid, I haven't really seen much benefit for people at all. Okay. I don't think you're going to get much help from doing either one of them, actually. All right. Thanks for that question, John. Good luck. Hello, Aaron. Let's see. I was here a few months ago when I was really suffering. I'm happy to report I have been on herbals for 4 months and I'm doing much better. Ah, great. I'm glad to hear that for you. Let's see. I had a positive Lyme, EBV, and Bartonella test. I had horrible psych symptoms with derealization, a sort of drug feeling 24/7 being the worst. I still have that symptom. Do you have ideas for dealing with the ongoing and very difficult symptom? All right. Um, so first of all, in terms of, so that sounds like a Bartonella symptom. All right. So when you have strong psychiatric symptoms, think Bartonella. Lyme can sometimes be a contributor, but think Bartonella. In terms of the symptoms, not all of your symptoms are going to improve at the same rate. Okay, so there are some symptoms that get better first, and sometimes you'll get a symptom like this that's going to hang around longer. So one thing to do is keep treating, and hopefully over time it will lift. Okay, make sure that you're taking things that are both herbal antibiotics designed to treat both Lyme and Bartonella. And again, my favorite for that Lyme would be the otoba and the cat's claw that I've mentioned before. And for the Bartonella, it would be Sida acuta and Houtenea. Okay. All right. Now, if those are pretty severe and you're still not getting far enough along, this is a situation where I might consider adding for maybe 1 to 2 months a prescription antibiotic. Okay. And the one I would consider adding, because it is such a useful, strong Bartonella antibiotic, would be to add in, one of two, either rifampin, 300 milligrams, 2 pills 1 time a day, or I would add in azithromycin, 500 milligrams, 1 pill 1 time a day. According to research that was published in April of this year out of Johns Hopkins, the 2 strongest antibiotics we have to treat growing Bartonella would be the azithromycin and the rifampin. Keep in mind, those both can help with the Lyme germ as well too. Okay. All right. In terms of anything else to use for that kind of symptom, we really don't have a good option for you. Sometimes prescription psychiatric medicines can be useful for that, but often it's just a matter of treating longer for your germs. Okay. Overall, I'm glad to hear you're doing better overall, though, and good luck to you. Thank you. Hello, Kelly. Kelly says, hi, Dr. Ross. It's Kelly in Chicago, and I know who Kelly is. Good to see you here again, Kelly. Take care. Hello, Carol. Hello, I have mold, Lyme, Bart, and Babesia. I've been on treating for Lyme and now Bart. How important is it, or does it matter what order I treat, mold or Babesia? Thank you for all you do. Um, I don't think there's an importance on the order. I think you need to look at what is your most severe symptoms coming from. For instance, if you have raging Babesia symptoms of drenching night sweat, severe air hunger, and panic attacks that are really just going crazy, I would go after the Babesia first, okay? I would look and see which one's giving you the most problem. All right. Thanks for the question, Carol. Good luck to you. All right. Listen, everyone, that's it for me for tonight. I've had a great time visiting with you. I wish everyone well. I hope you got some good ideas tonight. And sign up for next week. I'll be back here again next week, and then we'll take the week off after that. Okay? All right. And actually, I might take a couple weeks off because I think we're going to be running into the Labor Day week after that too. But we'll see. I have to plan out my schedule a little bit further in advance. But as you all know, I usually do 3 of these in a row. And next week we'll make 3. Okay. Tomorrow morning, keep an eye out on your email. Usually by 8:30 in the morning when my clinic opens here, I will have sent you that email. Sometimes I get it a lot earlier than that. It all depends on how my editing goes tonight and my writing up the summary of what we talked about goes as well too. Okay. All right. So thanks to everyone for being here. If you're finding benefit from these webinars, I appreciate it if you'd share this information, share the webinars, invite people to sign up and join in the webinars. I enjoy helping people, and the more people I can help, the better it is. And so please keep sharing the information about the work we're doing here. Okay. All right. And good night, everyone. I look forward to seeing you next week. Bye-bye.